Damage to ligaments. Joint ligaments are very prone to excessive stretching and even tearing and rupture. It's possible the opposing damaged surfaces on the ligament are brought together by poisoning and embolizing the joint. In severe injuries, surgical approximation of the cut ends may be required. The blood clot at the damaged site is invaded by blood vessels and fibroblasts. The fibroblasts lay down new collagen and elastic fibers which become oriented along the lines of mechanical stress. Trauma and infection, bursae and seminal cysts. Bursae and seminal cysts are commonly the site of traumatic or infectious disease. For example, the extensor tendon cyst of the hand may become inflamed after excessive or unaccustomed use. An inflammation of the prepatellar bursa may occur as the result of trauma for repeated kneeling on a hard surface. Veins are vessels that transfer blood back to the heart. Many of them possess valves. The smallest veins are called venules. The smaller veins or tributaries unite to form larger veins which commonly join with one another to the venous plexuses. Medium-sized deep arteries are often accompanied by two veins, one on each side, called concomitants. Veins leaving the gastrointestinal tract do not directly to the heart, but coverage on the portal vein. This vein enters the liver and breaks again into veins of diminishing size, which ultimately join capillary-like vessels. Disease of blood vessels. Diseases of blood vessels are common. The surface anatomy of the main artery, especially those of the limbs, is discussed in the appropriate sections of this book. The collateral circulation of most large arteries should be understood, and a distinction should be made between anatomic and arteries and functional and arteries. A large arteries that cross over a joint are liable to the kink during movements of the joint. However, the distal flow of blood is not interrupted because an etiquette the anastomosis is usually between branches of the artery that arise both proximal and disclinical. Example at the beginning of this chapter. Lymphatic system. Lymphatic system. The lymphatic system consists of lymphatic tissues and lymphatic vessels. Tissues are a type of connective tissue that contains large numbers of lymphocytes. Lymphatic tissue is organized into the following organs or structures: the flood to the blood. The lymphatic system is essentially drainage system, and there is no circulation. It happens because of the presence of numerous valves along their course. Vessels are found in all tissues and organs of the body, except the central nervous system, the eyeball, the internal ear, the epidermis of the skin, the cartilage, and the bone. Lymph is the name given to tissue fluid once it has entered a lymphatic vessel. Lymph capillaries are a network of fine vessels that drain lymph from the tissues. The capillaries are in turn drained by small lymph vessels, which unite to form large lymph vessels. Lymph vessels have a therapeutic duct. Disease the lymphatic system. Lymphatic system is often de-emphasized by anatomists on the grounds that it is difficult to see on a cadaver. How it is vital importance to medical personnel, since lymph nodes may swell as a result of metastasis or primary tumor.